All right, patient care, I think we're at part 4. We're starting with communication, so different types of communication. I know you know this, but just review kind of what falls under verbal versus nonverbal communication. Nonverbal being at a higher percentage of kind of importance realistically. Your eye contact, facial expressions, which I know are a little bit tough for us right now with masks on, body language. Verbal communication is your word choice, volume, attitudes, how good are you listening to what they're saying and responding back. Part of the communications section also includes patient education, so letting your patient know what to expect during the exam, how can they assist you, time frames, how long will it last, how long will the wait be, are there any restrictions, eating, medication restrictions, any of the above. Preps and post-procedure information, so like barium work or arthrograms or anything where there's possibly some post-procedure information, you're going to want to be able to explain that to your patient. Using clear and concise communication with terms that they will understand, right? So not using advanced medical terminology, but basics for your patient. Some challenges to communication could be, say, pediatrics or geriatric patients. So pediatrics, wanting to make sure that you're talking to the child and not just to the parent. Get down on their level. Don't assume geriatrics can't hear, so don't shout at them or assume that they don't understand you. Always go under the assumption that they do understand you and then go from there. Language, if there's a language barrier, don't just try and muddle through it. Make sure you request an interpreter. Cultural and social factors may also be a challenge. So depending on culture, education, family structure, gender, race, and religion, they may have specifics that they want you to follow for the patient. Concept of personal space will vary between cultures and social settings. So just being cautious of that and being aware. Different types of impairments may cause a difficulty with communication. So physical impairments, they could be visually impaired. They'll need clear instructions or guidance to your equipment, to the wall stand, to the table bucky. Hearing impaired patients, make sure they can see you and use demonstrations. Some may lip read and some may not. So just be aware. Traumatic impairment, so if you have a trauma patient, pain and shock can alter their response, especially those patients with head injuries. Be aware that they might not be able to control what they're doing. Cognitive impairments, your patient might have trouble remembering, learning new things, trouble concentrating. It could be maybe a dementia patient, and they're having trouble remembering things or able to make decisions that affect their life. And stress. Stress can cause the patient to be distracted and just fearful of the unknown. So be aware that your patient's state might be affecting their behavior. The 5 stages of death and dying might be involved too. So I remember it by this DABDA, so denial, anger, bargaining, depression, and acceptance. So initial stage is denial. The doctor's wrong. This can't possibly be happening. Anger. It's unfair. Why is this happening to me? Bargaining. Well, if I do this, will I get this result? Depression. And then acceptance are the 5 stages. Okay, so if you write this little abbreviation down, DABDA, to help you remember those. Different modalities. So as a technologist, you should have a basic idea of what is involved in the other technologies that we have in radiology. So CAT scan, it's a higher dose of radiation than X-ray is. The body will, appear in slices. MRI is no radiation, but it is a strong magnet. And if there's any metal in the body, they will have to go through a screening process and things like that. Mammography is breast imaging. It uses a small focal spot and low kVp. Sonography, no radiation, and they use sound waves. Nuclear medicine, the radioactive isotope is injected instead of our X-ray beam. And the bone densitometry is a fan beam, which is a very low dose radiation, and it checks the bones and kind of determines how dense they are. So in general, you should just have a basic understanding of what the different modalities are and do they use radiation or not. Is it higher or lower than diagnostic x-ray? And then there's this chart. I don't think you have to be super specific on this, but this chart kind of gives you an idea of some exams that we do compared to background radiation in number of days or years. So we'll start with, say, the chest x-ray. Chest x-ray gives you 0.1 millisieverts and is equal to 10 days of background radiation. And then a, say, chest CT is 6.1 millisieverts and equal to 2 years of background radiation. So you can see the CAT scans are significantly more dose than x-rays. And then if you go up here, they have the fluoro studies, so upper GI with barium or lower GI. They're right around 6 millisieverts as well. So that's essentially right in line with the CAT scans. So those are a lot more dose, and they're dosed to different areas, right? The chest is up in the lung field, so we're able to shield those areas. The barium enema, it's very difficult to shield for something like that. So the DEXA is always going to be very low. The bone density test is way down here, 0.001 millisieverts, so it's much lower. PET scans are much higher. Mammo uses a lot lower of a KBP, and then MRI is no radiation, right?